Welcome to the Get Fit Guy's quick and dirty tips to slim down and shape up. My name is Ben Greenfield and I'm the Get Fit Guy. In today's episode, you're going to learn about whether or not Kegel exercises work, how to do them, and much more. As private and potentially embarrassing a topic as this may be, I'll just go ahead and admit it. I've been doing lots of Kegel exercises lately. First defined in 1948 by this gynecologist named Arnold Kegel, Kegel exercises consist of repeatedly contracting and relaxing the muscles that form your pelvic floor, sometimes with the use of special weights and devices to increase resistance. Typically, Kegel exercises are done to help get rid of urinary incontinence, to reduce premature ejaculation, or to increase the size and intensity of erections. They can also be used to help pregnant women with childbirth or to recover more quickly from childbirth. Now, I'll let your mind go wild about which of those reasons inspired me to personally choose to try a 30-day stint of daily Kegel exercises, and I'm working on a separate article for that over at bengreenfieldfitness.com, but suffice it to say, Kegels have definitely been something on my mind lately. So, first of all, how do Kegel exercises work? Well, as I alluded to, the basic purpose of Kegel exercises is to increase the muscle tone, strength, and endurance of your pelvic floor muscles, specifically by strengthening the muscles of your pelvic floor that are called the pubococcygeus muscles. Yeah, that's a mouthful. Well, the most popularly prescribed use of Kegel exercises is to, like I mentioned, help pregnant women prepare their pelvic floor for the rigors of pregnancy and childbirth. But Kegels can also be used for vaginal and uterine prolapse, in which parts of your anatomy literally fall out of you, not pleasant, treating prostate pain in men, treating urinary incontinence in men and women, and helping with both premature ejaculation and also sexual performance. Now, the best way to describe Kegels is as follows. You just contract the same muscles you'd normally contract if you were trying to slow or stop a flow of urine. Often when you squeeze these muscles in a contraction, you'll feel your glute muscles contract as well, and sometimes even your lower abs. Perhaps a little less well-known fact is that barbells, weights, springs, or cones designed to be held in a woman's anatomy, and special weights designed to attach to a man's anatomy can actually increase the difficulty and effectiveness of Kegel exercises for a more advanced and difficult workout. So, do Kegel exercises actually work, or are they effective? While I'm keeping the results of my N=1 experimentation with Kegels to myself until I'm done with my own personal 30-day protocol, I do have a friend named Katie Bowman. I've interviewed her over at bengreenfieldfitness.com, and I'll put a link to that in the show notes to this episode, which is episode number 237 of Get Fit Guy, but she's not too enchanted with Kegels. And here's what Katie has to say about Kegels. A Kegel attempts to strengthen the pelvic floor, but it really only continues to pull the sacrum inward, promoting even more weakness and more pelvic floor gripping. The muscles that balance out the anterior pull on the sacrum are the glutes. A lack of glutes, meaning having no butt, is what makes this group so much more susceptible to pelvic floor disorder, also known as PFD. Zero lumbar curvature, missing the little curve at the small of the back, is the most telling sign that the pelvic floor is beginning to weaken. An easier way to say this is weak glutes plus too many Kegels equals pelvic floor disorder. So, like you just learned, Katie thinks that the regular use of Kegel exercises plus weak glutes could cause pelvic floor disorder and potentially make your pelvic floor muscles too tense, at least relative to the tenseness or strength in your butt muscles. Her recommendation is to instead work on building your glute muscles, your butt, and to focus on mobility moves that allow you to eventually be able to get into a deep squatting position. While I think this is probably sound advice for women planning on pregnancy and childbirth, the fact is that if you combine Kegels with glute exercises like squats or lunges and mobility exercises like deep bodyweight squats and side-to-side lunges, you'll probably avoid these issues with excessive pelvic floor tightening. In other words, if you're only relying on Kegels alone for pelvic floor strength, you might run into some imbalance and tightness issues. But if you're including other exercises for your core and for your lower body, you'll probably be just fine. In addition, decades of scientific research that I'll link to over in the show notes at quickanddirtytips.com support pelvic muscle exercises for boosting sexual performance, preventing the onset of erectile dysfunction, reducing premature ejaculation, and helping with urinary and prostate health. So, let's look into how to do Kegels and finish up this episode with a sample Kegel workout. So, here's 3 steps to do it. First, find the right muscles. As you learned earlier, to identify your pelvic floor muscles, stop urination in midstream or tighten the muscles that keep you from passing gas. These are your pelvic floor muscles. Step 2, once you've identified your pelvic floor muscles, is to lie on your back with your knees bent and a little bit apart. Tighten those pelvic floor muscles, hold the contraction for 3 seconds, and then relax for 3 seconds. Try it a few times in a row, but don't overdo it. As your muscles get stronger, you can do Kegel exercises while sitting, standing, or walking. And then you just repeat. And there's no hard and fast rule for Kegels, but what I've personally been doing is 10 1 to 2 second contractions, followed by 20 rapid contractions, followed by 20-second hold, and then 1 minute of rest, and then back to the beginning for a total of 3 rounds. Now, like I mentioned, I'm writing a more comprehensive article about the results of the 30 days of Kegels that I'm experimenting with, and that's going to be over at bengreenfieldfitness.com. But in the meantime, if you have more questions about how Kegel exercises work, then you can leave your thoughts and join the conversation over at the facebook.com/getfitguy page. And again, a big shout out to today's 2 sponsors, runkeeper.com/getfit and also privategym.com. Until next time, I'm Ben Greenfield, the Get Fit Guy, asking you, what are you waiting for? Go get fit.